When a patient is initially diagnosed with a brain tumor or when they may have a recurrence, there's so much coming at patients and families. But there are also critical junctures where getting the right information at the right time about these two very important concepts of biomarker testing to understand their tumor, and then clinical trials, which is participation in investigational research, is so important. The MyTumorID campaign aims to set up patients to understand these concepts and to be able to make really informed decisions about their care.
Hi, my name is Julio Pina. I have a brain tumor.
Hi, my name is Liz, and I'm a care partner for my husband, Julio, who has a brain tumor. In 2018, Julio was diagnosed with anaplastic ependymoma, and he had an awake craniotomy. When you have a brain tumor removed, pathology is run, and that's how they tell you what type of tumor you have. And usually, they also run extended panels. So we found out a lot of things about Julio's tumor, like that he had a mutation that is often seen in breast cancer patients. I think it's important to have biomarker testing and understand the results because it helps you make informed decisions about your health. So if you're searching for clinical trials online, you know what you're looking for that might be the most effective for you. If your medical team is suggesting a certain medication because of something they've seen in your pathology, then you can understand why it might be worth pursuing and whether it's worth the side effects that might be involved. If you're looking outside of maybe what's considered the standard of care and you want to suggest something to your clinical team, you can say, hey, this is something I saw in my biomarker testing and this medication seems to target that. Is it something we might be able to consider?
In order to precisely determine a treatment for a specific patient that could even deviate from the standard of care, we have to know exactly what diagnosis we're faced with. For the brain tumor community and for patients and families dealing with brain tumors, clinical trials are critically important. The reason we recommend clinical trials for patients is by and large because we think that we'll be able to provide better therapeutics for the brain tumor community through their participation in a clinical trial. A better chance for patients and families faced with a brain tumor today means that we know exactly what type of tumor they're dealing with, which is what we're advocating for through the MyTumorID campaign. It means that they have access to the best clinical trials available and new treatments that will continue to make treatment better for the future, and that they feel supported, that they know that they have all their options and can make an informed decision about their care.
Learn more about clinical trials and biomarker testing at mytumorid.org.